are going to demonstrate about the NG tube feeding. My kids are here to demonstrate about NG tube feeding. Each and every person, they are having a different task. By using the various articles, we are going to demonstrate what is the purpose of doing this feeding and what are the indication, contraindication, everything is there. They are going to tell about each and every one in a step by step. Yes, you have to start.
Hi all, my name is Adila from SNS Nursing. I am here to tell the definition of nasogastric tube. NG tube is defined as the administrations of medication into the stomach through the nostrils for the nutritional supplements.
Hello all, I am Frenubil. I am going to say the purpose of the NG tube feeding, lavage, gavage, decompression, compression and diagnostic studies. The articles required are an NG tube 16 to 18 French and a bottle of water to check the placement of the tube, and we have a 60 ml syringe to feed. We will only use the barrel of the 60 ml syringe.
You separate this one.
We use this barrel to feed the patient, and we have a motor and a vessel to crush the medications. And we have a stethoscope to assess the peristaltic movement and placement of the tube, and a measuring cup to measure the medications, and a plaster to secure the tube position. And we have lubricant jelly to lubricate the tube, and a gloves to protect ourselves, and a towel.
Take the towel and show.
And we have a towel to protect the patient's garments.
Yes.
And finally, a kidney tray
to discard the waste. Then how we will measure the NG tube?
We will be measuring the NG tube from nose to earlobe and from earlobe to Support process.
Yeah, that is tip of the nose to earlobe and earlobe to distal or Support process. Yes. Next.
Hello everyone, myself Sona. I'm from SNS College of Nursing. I'm here to tell about the indication of nasogastric tube. Indication for NG tube is the patient who cannot eat, and the patient who refuse to eat, and the patient who cannot maintain adequate oral nutrition, and patient on the surgery, especially on GI tract.
Yeah, especially on oral surgery. They can't be able to chew orally. In that case, we can do NG tube feeding. Yes. Next.
Good morning all, myself Tanushree from SNS College of Nursing. I am going to tell about contraindication of NG tube feeding and patient on nasal surgery and facial surgery and nose bleeding, and patient on anticoagulant therapy and facial trauma.
Yes. Next.
Good morning all, I am Viruthasarani. I am here to explain the procedure. First, we have to explain the procedure to the patient and perform hand hygiene. We have to place the patient in a Fowler's position, and you have to measure the NG tube from patient's tip of the nose to earlobe, and from the earlobe to the Support process, and then to check the NG tube with 10 ml of syringe by pouring water in it, and
we have to use the stethoscope
to auscultate the peristaltic sound in the bowl.
Next, one more method also is there to check the NG tube in the position, that is X-ray. By seeing the X-ray, we can be able to see that many holes are given in that NG tube. Previously, instead of that hole, that metal balls are present in that NG tube. By seeing that in the X-ray, so that tube is in a position. Nowadays they are replaced. Why? Because in some case the tube is damaged and balls is going inside the stomach. So that balls is banded. Instead of balls, they are keeping some holes. By seeing the X-ray, the holes is present on the tube and also it is present in the stomach. By seeing that in the tube is displaced in other case, we can't be able to see the holes and also balls. Okay. So by that we are checking the tube is in the position or not. Yes. Next.
For inserting the tube, we have to apply some lubricant jelly on the tip of the nose and insert the NG tube. By inserting, we have to tell the patient to swallow the tube. If any discomfort is felt, we have to take the tube. After injecting,
After insertion, you have to secure the tube by using the plaster. Yes.
then we have to feed the
You have to take a barrel of the syringe and you have to connect it, and based on the physician prescription, you have to feed the patient, whether it is medicine or it is the diet or the liquid, whatever it may be. By the consent of physician only we can feed the patient, or else you have to don't touch anything. Okay, if the tube is not in the correct position, how we are checking? Some signs and symptoms are there. That is, the patient is having the continuous cough or choking or irritability, dyspnea especially. If the patient they are having this symptom, means suddenly have to remove the tube and again have to wait for some time. Then have to reassure the patient. After that, again have to continue. You have to repeat the procedure. Okay. So by explaining itself, you have to reassure the patient. This is a small thing only. We are inserting through your nose, and the tube is reaching your stomach. Through that, we are feeding by the tube only. Why? Because you are not at all able to take any food orally. For that purpose only we are inserting. So please cooperate us. Like that, you have to explain the procedure to the patient. Through explaining, we are getting reassurance from the patient. Okay. Then what is the aftercare?
after feeding, you have to replace the tube and clean the mouth and give the patient the
And
water.
always you have to close the tip of the another end of the ET tube. Why? If the air is entering into the tube, it will give a irritability. The stomach capacity will be increased. They can't, and they feel a distended stomach, the fullness of the stomach. So you have to always, after feeding, you have to close the tip of the tube, and you have to document everything. What kind of feeding you have given to the patient and what time, and which consent, that is, which physician is ordered for some food or tablet. Everything have to document with the date and time and with your signature. That is very important. Recording and reporting is very important. Right? Yes. Any doubt you have in this? No. Are you clear?
Yes, ma'am.
Everyone?
Yes, ma'am.
Yes. So with that, we conclude this today's